Hi, welcome in. Were you waiting a long time? Sorry about that. Yeah, it's a bit of a busy day today, but we're here now. Thank you for coming. I'm just pulling up your file really quick. Okay. So this is just a basic checkup, correct? Okay. Any concerns before we get started? Okay, nothing off the top of your head. Okay, that's fine. We'll go through, get your vitals, and do some basic checkups. Before we start, I want to ask you a couple questions. Let's see. So I see that you're on Wellbutrin, 150 milligrams. Has that changed or anything? Okay. And how is that working for you? Okay. So for right now, you don't want to change that dosage or anything? You're good with that? Okay, cool. And are you getting that through a psychiatrist or through here? Okay. Yeah, I can get you a prescription today before we leave. Are you running low on that? Okay. Yeah, I can go ahead and give you a 3-month prescription. And that'll just help for a couple months, okay? No worries. And are you pregnant or nursing? Okay. Planning on getting pregnant? Okay. And if you have a cycle, when was the last period that you had? Okay, it's about to start, so say like maybe 25 days ago? Okay. And that's been regular? Okay. Perfect. It says here that you don't drink or smoke. Has that changed at all? Okay. So like maybe 1 alcoholic beverage a week? Okay. Good to know. And then any recreational drugs? Okay, good. And it says you have a partner. Are you using any protection or anything? Okay. Okay. Well, we can get started. Thank you for answering those questions. I'm just going to put on my gloves in a second. Well, besides all this medical stuff, how's your day going so far? Good, good, good. Let's see. Okay, I'm gonna start by just checking your breathing really quick. Okay, I'm gonna put this on your chest. I just want you to breathe normally for me, okay? Okay, I'm gonna move to your back now. Okay, can I have you take a deep breath for me? Okay. And then again on your chest, take another deep breath. Okay. Breath sounds are normal. Looks like I need some smaller gloves. Yeah. They'll do for now, but next time I order, I need to get a smaller size. Okay, I'm gonna check your blood pressure now. Can I have you put out your arm for me and roll up your sleeve, please? Thank you. Okay. Go ahead and put this on and then tighten it. How does that feel? Okay, nice and tight. Okay. And I'm just going to okay, 161 over 78. Pretty good. Okay. Put this away. Ooh. Yeah, I just got this new stethoscope and it's really cute, but it's kind of short. Having trouble keeping that on. Okay. So let's move on. I'm going to check your eye health now. Any changes in your vision? No? Okay, good. And you don't wear contacts or glasses or anything like that, right? Okay. Okay, I'm just going to have you just look straight ahead at me. You can look at my nose, and I'm just going to check your pupil response really quick, okay? So, yeah, it is bright. Okay. Can I have you follow the light without moving your head, okay? Okay. Now, I'm just checking to see. Again, I'm just gonna have you can actually look to the side right there. Okay. And look over here this way. Okay. Very good. Excuse me. Okay, I'm gonna check your reflexes now. So I'm just going to check your legs first. So I'm just going to okay. Go ahead and relax your leg for me. Okay, so having a little bit of a delayed response with the reflex hammer. I'm going to try this on your elbow, okay? So I'm just going to make sure your arm is really relaxed, okay? Okay, your other arm. Okay. Yeah, I don't really see a response to the reflexes. I'm gonna go ahead and make you an appointment with our neurologist just to see if there's anything. I'm not concerned immediately for that, but just to be thorough, okay? Okay. So I'm gonna give you their information, and I want you to call and set up an appointment, okay? Yeah, we're pretty much done. I'm just going to fill out a prescription for the Wellbutrin, okay? Yeah, no worries. Okay. And are you still at the CVS down the street? Okay. Yeah, I just sent in a request for 3 months of the Wellbutrin, 150 milligrams, and you should get a call from them today to tell you when it's ready to pick up. You're so welcome. Well, I think that's all I need you for today. Do you have any extra questions for me? Any concerns that you'd like to bring up? No? Okay. Well, it was great to see you, and have a great day, okay? Make sure you schedule that appointment, okay?